Well, welcome. This picture here is from the July edition of the Washington State Medical Association Journal, just this last summer. So it's getting headlines. Health at risk, Washington physicians see the physical tolls of climate change. And I'm a family physician I work both in Ellensburg and in Yakima. And I've been pretty concerned about climate change for a long time, probably closing in on about 20 years. But in the summer of 2014, with the really large wildfires in the Okanagan, I was seeing worsening asthma and COPD exacerbations in the summer, which was kind of unusual because most of it occurred during the flu season when people were burning their wood stoves. And it was at that point I realized that climate change went beyond polar bears and that we were seeing the effects of climate change on health in central Washington. So just briefly, rising temperatures are causing observed changes across a range of climatic indicators. We're having more heat waves, more severe storms and floods. That was on the news today in the South, huge floods. Increasing drought, bigger and more wildfires, rising sea levels, and ocean acidification, which we've noticed over on our own coastline. This prompted a development of a new organization called the Medical Society Consortium on Climate and Health, and it was launched in March of 2017. It includes 500,000 clinical practitioners, 20 medical societies, including the American Medical Association, the American Academy of Family Physicians, for which I'm a member, the American College of Physicians, the American Academy of Pediatrics, and ACOG. And they all agree that climate change is harming Americans today, and these harms will increase unless we act. And the way we need to act is that we need to decrease use of fossil fuels, conserve energy usage, and increase our utilization of clean energy sources. This is a very busy slide that introduces the whole topic of climate change and human health. As you can see, there's lots to it. This information comes from, the primary source is a presentation from the report of the U.S. government Global Change Research Program, and also the Intergovernmental Panel on Climate Change. And these are comprehensive, evidence-based, and where possible, quantitative estimations of observed and projected climate change-related health impacts and are available online. I've also included an excellent article from the American Family Physician that was published this fall that has a lot of references, a lot of resources that I hope you'll take advantage of. This comes from the Medical Society Consortium, and basically what it shows is that the impacts of increasing temperatures will not be uniform across different geographical areas. So here in the Northwest and also in the Southwest, we see these increasing frequencies and duration of wildfires. Also in the Southwest, we see worsening drought, extreme temperature and storms in the Southeast and in the Northeast. Excuse me. And in the Northeast and Midwest, we also see increasing flooding and downpours. And we can see multiple health-related conditions can occur at the same time. This is from Howard Buckner of the Journal of the American Medical Association. Today, in the early part of the 21st century, it is critical to recognize that climate change poses the same threat to health as the lack of sanitation, clean water, and pollution did in the early 20th century. So what are Americans thinking about with respect to health and climate? So Americans place a high priority on health. They spend about 17% of the country's gross domestic product directly on health. 66% worry about environmental pollution impacting their family's health. 79% agree that keeping their communities free of toxic chemicals and pollutants is a personal right. But fewer than 5% of Americans correctly identify the health impacts of climate change. Physicians, on the other hand, have a fairly high degree of awareness of climate change and health. 64% think climate change is directly relevant to patient care. The climate-related health problems most identified were those related to air pollution, such as asthma, chronic lung disease, cardiovascular disease, and an increase in allergy symptoms. 64% believe physicians have a responsibility to bring the health effects of climate change to the attention of their patients. And 76% agree that physicians should take a leadership role in encouraging office, clinics, and hospitals to be as environmentally sustainable as possible. So I'm going to spend a little time on this topic of some Americans being more at greater risk for the health impacts of climate change. So across the US and the world, people and communities differ in their exposures, their sensitivity to these exposures, and ability to adapt to climate change. Health impacts vary by age and stage of life. And I'm just gonna. Young children's biological sensitivity places them at higher risk for asthma, diarrheal, and heat-related illnesses. For example, in the US, currently approximately about 9,000 high school athletes are treated for exertional heat illness such as heat stroke and muscle cramps per year. Extreme heat, airborne pollution, and events such as flooding have been linked to an increase in low birth weight and preterm birth in pregnant women. Older adults, like young children, are more sensitive to the effects of climate change, especially those with chronic diseases such as asthma or COPD. The mentally ill may adapt less well to the stresses of extreme events or heat. And there was a very good report on NPR talking about the mentally ill, and a lot of it has to do with they can't organize themselves to be aware sometimes that there are these risks out there. Socioeconomic status is another really big issue, and it's linked to the ability to adapt to climate change. And since communities of color have higher poverty rates, this affects their ability to prepare, respond to, cope with climate-related risks. And then, as we're very aware out in Eastern Washington, working out of doors. These are people who work out of doors and are higher sensitivity to heat stress. So farmers, farm workers, construction workers, first responders will be more affected as we go on and the climate changes further. Indigenous communities like the Yakima native population and also the Alaskans are experiencing food and water insecurity and loss of their cultural identity. So the next area that I want to, this is an introduction. It's a really big area, but I'm going to start with air pollution and allergens. So, and I'm using as a source this U.S. Global Change Research Program, and these are the impacts that have the highest confidence intervals around them. So exacerbated ground zone health impacts, increased health impacts from wildfires, worsened allergy and asthma conditions. So ozone, not the ozone in the atmosphere, but the ozone that is produced as a component of smog, it results from chemical interaction of sunlight and pollutants from cars, fireplaces, wildfires. Higher temperatures, stagnant air conditions lead to higher levels. Current levels of ozone are associated with tens of thousands of ER visits, millions of acute respiratory symptoms, school absences, and premature deaths in the U.S. yearly. Tens of thousands of additional ozone-related illnesses and deaths per year are predicted with climate change. Those particularly at risk are the poor, who often don't have access to medications as easily, and oftentimes live in asthma-prone areas, urban environments, and lack air conditioning and ventilation. Wildfires emit fine particles and ozone precursors that in turn increase the risk of premature death and adverse chronic and acute cardiovascular and respiratory health outcomes. And we'll talk a little bit more about allergies. Allergies are highly prevalent. 34 million U.S. adults have asthma and allergies, and so these will be worsened in this new reality. So here's a little local information about ozone in the Tri-Cities. Ecology, the Department of Ecology with Washington State University and the Benton Clean Air Agency conducted this Tri-Cities ozone precursor study. And they found that ozone levels, it's not, the really bright yellow-orange area is the Seattle area, but you can see also around Kennewick, they had fairly high ozone levels there and a danger of becoming a non-attainment area. So this is just a good illustration of what the projected wildfires in the U.S. will look like and where they are located. And you can see that the West really predominates in this slide, and particularly around Montana and Washington. You see that. You don't see it as much in California, but we know we've been seeing a lot of wildfires there. And so wildfires in the western U.S. are more frequent, will be and are more frequent, larger, and lasting longer. And of course, we're seeing increased ER visits for asthma, COPD, and coronary artery disease. So in 2014, we had the Carlton Complex fire. It was the largest in Washington history. But in 2015, brought an even bigger set of fires. 3 firefighters lost their lives fighting that Twist River fire, and thick blankets of smoke just covered the whole region. We really got it in Ellensburg quite a bit, but it covered other areas. You can see Montana, Wyoming, Colorado, and caused a lot of breathing issues. This report came out last summer from the American Lung Association. It's called The State of the Air. They do it every, I think, 3 years. And this showed that more than 4 in 10 Americans, approximately 43.3% of the population, live in counties that have monitored unhealthy ozone and or particle pollution. The American Lung Association said in this report recorded that heat is increasing wildfires and other pollutants in the U.S. Yakima ranked 6th in the nation for highest level of short-term air pollution during this time period, and we know we experienced that, followed by Seattle-Tacoma, which was 9%, and Spokane Valley, 16%. This is directly related to those wildfires. In the U.S., more than 2.5 million children and more than 9.7 million adults with asthma live in counties that received a failing grade for at least one air pollutant. And in their summary, they said, they concluded that the efforts to weaken the Clean Air Act and climate change will make cleaning up our air more difficult. And we've made such strides over the past several decades. And then allergies, we're seeing that ragweed pollen seasons are starting earlier and lengthening, particularly in the northern latitudes. And pollen is associated with an increase in carbon dioxide levels. So as carbon dioxide levels increase, pollen does too. I'm going to turn quickly to tick and mosquito-borne diseases. So key findings of the U.S. Global Change Research Program. You'll see these are the things that we are expecting: changing distributions of vectors and vector-borne diseases, earlier tick activity. We don't have the type of tick that we see the Lyme disease, but in the Northeast they are seeing this in northern range expansion, changing mosquito-borne disease dynamics, and new emergence of some new vectors that vector-borne pathogens that we haven't seen before. And at higher risk are those who work outside, children and the elderly, or those with lower immune systems. As we start to develop some climate adaptation programs, we need to look at what will be protective factors, how we can protect our population from these new infections. Factors that lower rates of infection include having higher income, which not everybody has, of course, screens on doors, and air conditioning are protective. The Northwest region has seen an increase in some infectious diseases and some fatalities, such as the West Nile virus, which you've had here in this area. With the West Nile virus, 70% of those affected don't have symptoms. 20 to 30% have a kind of an acute febrile illness, headache, muscle aches, rash, stomach symptoms. It can also cause a meningitis, but extremely rare. It's underreported, but the peak occurrence is in June and September. So this is just to indicate we're seeing this march of tropical diseases spreading northward. West Nile virus, I cannot say this name, chikungunya, Chagas disease, cryptococci fungus. Now, cryptococcal infections are extremely rare, and we didn't see them much, but now this infection is established in Northwest soil. And it's associated, incredibly rare, still very rare, but it is associated with kind of an atypical pneumonia, and it responds to antifungals. But they feel that its recent appearance is related to climate change. And then there was this interesting bump in disease cases from infected mosquitoes, ticks, and fleas that the CDC noticed in 2016. And they really feel this is that increasing tick-borne and mosquito-borne diseases from other parts of the world. And they state that reducing the spread of these diseases and responding to these outbreaks will require increased public health capacity. And this is just a little more local. West Nile virus mosquitoes are found in Benton and Franklin counties, but only since about 2008. 2005 was the first human case in Washington State, and first cases in Benton or Franklin County were in 2009. I'm going to briefly talk about water quality impacts, but as you can see in this picture, raw sewage and toxic chemicals are mixing in Hurricane Harvey floodwaters, and here these poor cows are eating and pooping into the floodwaters. So key findings of the U.S. Global Change Research Program, you're going to see seasonal and geographic changes in waterborne illness risk. Runoff from these extreme precipitation increases exposure risk, and water infrastructure failure. So climate change is expected to affect fresh and marine water sources in ways that will increase people's exposure to water-related contaminants. And we do know that waterborne pathogens cause about 12 to 19 million cases of gastroenteritis a year. So when runoff from a high precipitation overwhelms sort of the capacity of the municipal waste systems during storms, then human waste can contaminate those surface systems. And flooding can be followed by outbreaks of diseases. So this comes from that Intergovernmental Panel on Climate Change. And they've noticed that you get these big outbreaks of diseases such as cholera, typhoid fever, and hepatitis A, these are worldwide. But even in the US, 67% of waterborne disease outbreaks were preceded by precipitation above 80th percentile. And just to give you a case, the Oregon Health Authority looked at some of these cases, and there was this very large outbreak of shigellosis, which of course is a bacterial diarrheal disease. And it occurred in late 2015, and it affected a huge number of homeless people. And it was definitely associated with an unusually extreme precipitation. And then just internationally, it's important to remember that diarrheal disease is such a big killer of children. 1.8 million deaths each year. And this is just a very busy slide that shows how you have, this intense precipitation causing residential runoff and whatever is on, or farm and livestock runoff into the river, and all that big nutrient contaminant loading producing these algal blooms. People are exposed through drinking water and recreating in our fresh and coastal waters. There's an interesting case occurred in 2015. There was this really large algal bloom off the coast of the West Coast, from California to Alaska. And I don't know if anybody spends any time over at Long Beach, but I personally remember you couldn't go to the beach, you couldn't do anything, you couldn't dig clams. But they had this really high levels of domoic acid, which causes neurological kinds of symptoms. And in early 2016, there was this very large algal bloom that impacted the local economy in Long Beach. And it just had this kind of ripple effect. That area is very dependent on shellfish, tourism, and service industries. And the local food bank, of course this is just an association, recorded an almost 25% increase in the number of families requesting assistance in the 6 months that followed. And then here locally, in your own Scootney Reservoir, several years where we didn't, 2007 to 2014, you see you were having that Scootney Reservoir closed because of these algal blooms, but starting in 2015, seeing these toxic algal blooms, and just an interesting association. So I'm going to move on to food insecurity issues around climate change. Key findings of the U.S. Global Change Research Program: rising carbon dioxide lowers nutritional value of food. This has been documented. And worsening drought and decrease in crop yields. And this is this comes from the Intergovernmental Panel on Climate Change, showing over time what we expect the drought conditions to be. So 2000, 2009, but if you move to 2030 to 2039, and you just focus on the United States, you can see that we're moving toward drier conditions to the red, the purple, and then 2060 to 2069, more drought. And we can see the other countries, South America, Africa, being affected, and then further. So what does this mean? Well, they've looked at it and looked at projected crop yields, and by 2050, as you can see, many of the breadbasket, you're seeing a percentage change in the yields and a drop in projected yields. I'm going to quickly move to heat-related illness. Of course, we've talked about outdoor workers becoming more susceptible to heat-related illness in above 90 degrees. If the heat index goes to 100 degrees, above 100 degrees, children, elderly adults, pregnant women, and people with underlying conditions being at higher risk, and so forth. Greater than 105, anyone could be at risk of heat-related illness or even death as a result of prolonged exposure. Key findings of this global change research program: increase of thousands to 10,000s of premature heat-related deaths in the summer, and some populations at greater risk, older adults and children. And certain populations, those who live in urban areas, at our higher risk, and here several cities that have experienced extreme heat incidents. These are fairly significant. Russia, 11,000 to 50,000 people died when they had an extreme heat incident. 118 in Philadelphia, heat wave in 1993. India, 2,330. And how this works is where a person lives matters. Urban heat island effect is where man-made surfaces absorb heat during the day and then they radiate this stored energy at night. And you add to that the poor air quality, and that really compounds the health effects. And this is just showing where we are in terms of future warming will depend on our emission choices. So if we don't do any kind of action, we're going to see an average global increase in temperature of 4.3 degrees centigrade. Slow action, 2.4. Rapid action, which is what we need, of 2 degrees. Historical, you can see where we were going there. So just to give you a sense of what's at stake. And this is a slide that just shows the frequency of extreme heat by late century depends on the choices we make. And you can see there how even if we did get control of these emissions and did very aggressive action, we're going to still have problems, but they won't be as bad. And this is an interesting tool that took the study information from this previous study by Christina Dahl that was used for this slide, and it was increased frequency of and population exposure to extreme heat index days in the United States. They took it and created a tool so you could put in where you live, and you could look at how hot it might be, how many days you might have in a year where you'd have over 100-degree temperature. And so this is for Kennewick Pasco. I've looked at it for Yakima. I've looked at it for the South. In the South, it's just absolutely unbelievable. Historically, per this modeling, 1 day per year of temperatures above 100 degrees. Mid-century, about 19. Late century, we expect there to be 39 days per year, so that's from about 2070 to 2099. But if we have bold action on decreasing carbon emissions, we can keep it to 12 years. And then this is a whole area of just extreme weather, what that means, forced migration, conflict, and mental health effects. And the U.S. Department of Defense back in 2014 developed a climate change adaptation roadmap report, and they, summarizing from that report, they said climate change will likely lead to food and water shortages, pandemic disease, disputes over refugees, and destruction by natural disasters in regions across the globe. And this information comes from basically the insurance companies looking at trends in extreme temperatures, droughts, and fires. This is over a 30-year period. Floods, mudslides, storms, and you see this just steady march up in terms of extreme weather catastrophes. And we can't forget mental health effects of all these things that happen, all these extreme events. Here we have several, snapshots. One from Science. Most American teens are frightened by climate change. Poll finds about 1 in 4 are taking action. Katrina survivors, psychiatric needs are unpredictable. And studies of these populations who have experienced extreme events found that 49% of the survivors of Hurricane Katrina developed an anxiety or mood disorder, and 1 in 6 developed PTSD. Suicide and suicidal ideation more than doubled. Turning to another type of extreme event, drought. In the 1980s, there was a very, very severe drought in the upper Midwest, and they noticed, of course, these are associations, that the suicide rate doubled, including among more than 900 farmers. And this is just to put a price tag on climate change and its health impacts. So $10 billion in health costs from 10 U.S. climate-sensitive case studies this was published in September in the Journal of GeoHealth. And the scientists found that they examined health impacts and costs of 10 climate-sensitive case areas, including wildfires in Colorado and Washington. And this was 2012. This was before the 2014-2015 wildfires. And they also looked at air pollution in Nevada and extreme heat in Wisconsin as just an example. An excellent study showing these climate change is impacting our health, but also our pocketbook too. So I'm going to spend a bit of time here on what can you do as providers, because I think that's most important. But the Intergovernmental Panel on Climate Change, the most effective measures to reduce vulnerability in the near term are programs that implement and improve basic public health measures, such as providing clean water and sanitation, providing secure essential health care, vaccination and child health services. Increasing and planning for these disasters is really important, and alleviating poverty. So healthcare is the second biggest commercial energy user and accounts for about 9% of greenhouse gas emissions. Consider joining Healthcare Without Harm. It's working with hospital systems worldwide to reduce healthcare's footprint. And you have this presentation with all the references. Ask your public health department if they have a climate adaptation plan, and if not, in the handout that I gave to you from the American Family Physician, that paper has some examples where you can find adaptation plans. But here is another one, Cascadia Partner Forum, and just locally, we have Virginia Mason is in Yakima, and they joined this 2020 Healthcare Climate Challenge. The hospital system did, and this was joining with about 9 other healthcare institutions around the world in pledging action on climate change. And they deliver about 1.5 million meals annually in their healthcare system, and almost 40% of the supplies are locally produced or certified as sustainable. They've also received awards for energy conservation, recycling, and elimination of hazardous products from the workplace. In your practice, I direct you to mygreendoctor.org. It's a free management tool for making your practice more environmentally sustainable. They have patient education materials on extreme heat, stress to add nature, bicycling, the co-benefits of bicycling. And so that's another nice resource. And then this is an excellent report, Mental Health in Our Changing Climate. The American Psychological Association published it. It's online, and this helps. I hear a lot about young people feeling anxious, fatalistic, fearful. My own niece said, "Mom, why did you have me if we were going to have to deal with this?" I've heard that from other kids as well. So we need to foster optimism among our youth and among ourselves as well. And our psychological, our psychiatrists and our psychologists can help us in figuring out ways to do that. And we use a lot of these techniques as providers in our own practices. And then I like to emphasize the win-win, health and climate co-benefits. If you're, because if you encourage walking and cycling, eating locally produced foods, eating a more plant-based, not necessarily vegetarian, but a plant-based diet, all these things can help not only the planet, but also our heart disease, respiratory disease, obesity, and mental health issues. And this is just a busy slide, and this comes from the BMJ, the British Medical Journal. And then this was an interesting article. I did a talk on plant-based diet with one of the nutrition professors at Central. So this article came out. It's a global modeling analysis of nutrient levels, diet-related and weight-related chronic disease mortality, and environmental impacts for more than 150 countries in 3 sets of diet scenarios, but basically moving more to a plant-based diet. So in high-income countries, this lowers premature mortality, reduction of up to 12%, and reduces greenhouse gas emissions of up to 80%. And this was published in the Lancet Planet Health Journal. And then one of the most important, actually I would say one of the most important solutions that can really rapidly decrease carbon emissions is a carbon pricing scheme. And this is from the Lancet, and it says, a single most powerful strategic instrument to inoculate human health against the risks of climate change would be for governments to introduce a strong and sustained carbon pricing in ways pledged to strengthen over time until the problem of carbon emissions are brought under control. And then if you want to do more, get in touch with your medical association. Washington State Medical Association is doing a lot in this area. I'm a family physician, so I know a lot about what the Washington Academy of Family Physicians is doing. And if you are a member of AAFP, they have a climate change and environmental health member interest group to share ideas and action ideas as well. And then joining the Medical Society Consortium on Climate and Health. And then I am a co-chair of Citizens Climate Lobby, which is a nonpartisan group that is working very hard to do the non-sexy type of advocacy of trying to get a carbon pricing national legislation passed called the Energy Innovation and Carbon Dividend Act. And just these are the children, these are the kids we're working for so hard to make sure they have a positive and a healthy future. Climate change hurts real people right now. In public health, when faced with threats to entire populations, we act. For infectious diseases, we vaccinate. For lung cancer, we ban smoking. For injuries, we install seat belts and airbags. And for obesity, we promote physical activity and healthier eating. For climate change, we need to act. This is from Howard Frumkin, who was the Dean of the University of Washington School of Public Health. Thank you very much for your attention.